they're hysterical.
The only thing good about TikTok is the animals.
I love the animals on TikTok.
Oh,
Yeah.
Pretty good. All right, so these microphones are low sensitivity. My little spiel. So you want to keep about this distance, which is where you're at is perfect right now. Yep.
He calls it surfer distance.
Yeah, surfer distance. Where you're at is perfect.
Hey,
and this mic will pick up the p sound unless you just talk right over it and you have a natural conversation. That's perfect. It'll pick you up. And these headphones are for you.
Okay.
And you will be able to hear yourself and Eva.
Do I really want to hear myself?
Yeah.
It's kind of nice. Try it out.
It's a good place. The headspace is pleasant. You want to be here.
Make them smaller?
Yeah, I think
Okay.
Is that okay?
Yeah.
Great.
Oh, wow, this is wild.
Yeah.
If you hear me go,
I think you'll be slow.
Do you say your last name LoTempio or LoTempo?
LoTempio, you did it perfectly.
Oh, I did it.
Yeah, perfectly. That's rare. LoTempio. One word.
Got it.
You want to put them on one more time and have your hair just like brush back into it? Yeah, perfect.
Okay.
You're never worried about my hair, Dave.
You're solid. You got it done. You guys look great.
All right, is this okay?
That's great. Yeah. Just don't want to turn
okay.
stuff.
Yeah, it looks good.
Good.
All right. I'm rolling, so whenever you're ready, take your time to get started.
Today, my guest on Meet the Doctor is Maria LoTempio. She's a double board certified plastic surgeon in New York City. Welcome to the podcast. It's good to see you.
Thank you, Eva. This is such an honor, such a pleasure to be here this morning, especially to be able to discuss life with you. I'm excited.
It's a beautiful morning in New York City, and I think it's as good a place to start as any is to just ask you, are you from here?
I'm actually from Buffalo, New York.
Buffalo.
I'm a Buffalo girl.
Oh, boy.
Yep, I know.
And are you a Bills fan?
100%.
Oh, boy.
Die hard.
When I lived in Houston, all my friends were from Buffalo, and so I used to go to the Buffalo Bills backers bar, and they ran the official Bills backers club, and so I was an honorary Bills fan for many years, before the Texans were in Houston.
So my friends always laugh at me because we could travel anywhere in the world, and I will gravitate and meet Bills fans. And in any bar, in any city, in any country, there's a bunch of us.
Like you have radar for each other.
We do. We just pick each other up, and
Isn't
we
that
just
weird?
gravitate towards each other.
And you're not even wearing Bills clothes. You're just like...
Never.
No.
But you just know.
Huh.
There's just something about us. We're magnets. We just like attach.
Yeah. Seahawks people are like that too.
Yeah.
Which I learned because I married one of those.
Yeah, we love sports. We're very loyal. Loyal, and it's difficult to be loyal to the Bills at times, but we all are.
That's very true.
We all are.
When did you leave Buffalo?
Gosh, that's a hard question. I mean, I've been in and out of Buffalo probably since I've been 15 because I used to train in Canada for ice skating. And then I officially left for college. And then from there, I went back for medical school. And then from there, I pretty much left permanently. But I still go back. As a matter of fact, I'm going back today, right after this podcast.
Okay. What are you going up there for?
Today is the Allentown Art Festival in Buffalo, which is a beautiful event where they close the street downtown and you can look at all the different art vendors and eat wonderful, traditionally fatty food that's horrible for you, but only you can find in Buffalo. So I'm very excited about it.
Are you going to drive?
I'm going to fly.
Okay. I was going to ask, okay, so you said ice skating. Were you training to be a figure skater?
Yes.
Did you think you were going to be a professional skater?
I think you always go into it thinking that maybe, like you always say, I want to be a princess, or a little bit of you want to be a queen when you grow up. I always wanted to be a figure skater. I always wanted to go to the Olympics, but that wasn't really in my future. So I think deep down inside, I knew I always wanted to be a doctor, and that kind of superseded anything.
And I've interviewed a lot of doctors this year, and I've been asking the question a lot, like, when did you know you were going to be a doctor? And they always fall into one of two buckets. Either they always knew from the time they were a little kid, I'm going to be a doctor. Or they were doing something else really well, like you were, and then all of a sudden something happens and they switch to, I'm going to be a doctor now. And it sounds like, is that accurate, that that's sort of what happened to you?
Somewhat. I was 6 years old, and I always had ear infections and throat infections. I was just one of those kids that were always sick. And I was always at the pediatrician's office. And one time when I was 6 years old, he took out the stethoscope and was listening to my heart and lungs. I'm like, I come here all the time, and every time I come, you put this black thing on me. What are you doing? He goes, I'm listening to your heart. And I said, oh. I said, are there other things in there that you can listen to? And he goes, yes. I go, what are they? He goes, we call them organs. And then I said, oh, so if something goes wrong, are you a doctor to fix the organs? He goes, well, I treat the organs, yes. I said, well, if something goes wrong, how do you get to them? He goes, well, that's a surgeon. I said, well, how does a surgeon get to them? And he said, you have to cut to get into it. And I turned around to my mother and I said, I'm going to be a surgeon.
When you were 6, you did this?
6 years old.
Was anyone else in your family a doctor?
No one was ever in the medical profession.
Yeah. So you were just skating until you could be a doctor. And then you headed off to college. Where did you go?
Georgetown University.
Oh, Georgetown.
Mm-hmm.
And did you stay there then for medical school or no?
No, my father said, hey, you've had enough fun. I've spent enough money. Let's come home to Buffalo so I could get a little break financially. And I was very, very fortunate that my father and mother were able to provide education for me. So I said, okay, I'll come back to Buffalo.
So tell us about the path from Buffalo. I mean, it's covering a lot of ground, but from going back home to kind of where you are now, what did that look like?
Yeah, so, well, you could imagine after years in Buffalo for medical school, I was like, that's it, I'm done. I need sun, I need warm. And I immediately moved to Los Angeles. Half of my family in their 30s went to Los Angeles, and all my roommates in college were from Los Angeles in Orange County. So for some reason, I always had this beach blonde image of myself, even though I'm brunette and hazel eyes. Dyed blonde now. But I just gravitated to the West Coast. So I was fortunate enough to be accepted to a really prestigious head and neck program at UCLA for 6 years, and completed that and did well. And decided that it was time for me to do a fellowship. So all the residents meet with their chair, and most of us in head and neck surgery go on and do like a facial plastic fellowship, which is generally 12 months. And my chair said, no, that's not your path. And I said, I don't understand. And I was crushed. I'm like, why? He goes, no, I think you're so talented. You should go on and be a plastic surgeon and learn about reconstruction from the whole body. Because that was really my emphasis initially. And I was like, what? I'm already old, another year, where am I gonna go? And he's like, no, I think this is the right path for you. And you know what? He knew me better than myself, because that was 100% the right information to relay, and I credit him, Gerald Burke, for where I am today.
Were there a lot of women in this program, or not really?
UCLA was very heavily endowed with a lot of women surgeons. So I was very lucky to be in a program where there is many women, and I never really thought like I was a woman, there was anything weird about that in this particular program, because there were so many of us.
Was any part of this training particularly challenging for you?
What part?
All of it?
To be a surgeon's challenging. Sure. I think we all in our lives have problems with moments in our life where things are just really stressful. And to achieve something, you really have to put forth the effort and the determination. But you really need support, and I was super lucky. I came from a family. I have a great social and friend network that really supported me even in the down times. And I just kept going. And sometimes people know you better than yourself.
Sometimes being told no is the best thing that can happen to you.
True.
So how did you get back to the East Coast then from LA?
So I moved to South Carolina. I inched back slowly, still in warm weather. And then from there, I was in a residency program that had a very famous breast surgeon who was there because of Katrina. And I was put on his service. And during that time, he said, hey, I don't think your life's back in LA. I think your life is more here. I don't think you're going to go back doing, head and neck reconstruction. I think you're going to be doing more breast reconstruction. And by the way, would you like to do my fellowship? So I was like, oh no, another year? So,
By then they knew you were great at being in school.
Yeah, I think I was like a permanent, official student here. But because of him, I joined his fellowship, and that brought me to New Orleans and to New York City. And I was like, okay, it's the first time in gosh, how many years I'm actually close to my family up in Buffalo. So after my fellowship, unfortunately, parents get older and they get sick, and my parents were getting some medical problems that they were having, and I thought that at this point it would be better to be closer to home than far away. So I decided that I think New York City was going to be my home. Never looked back.
Before we get to what you're doing today, I want to ask you why fellowship training is important from the patient perspective.
I think that patients need to know that you actually have a niche and you actually have that expertise and additional training. And I think that separates you from so many different angles, not only from your experience, but from your ability to experience different individuals from different parts of the country, different medical issues, and it really becomes, I think you become more well-rounded when you do extended training.
About how many patients would you see in a typical fellowship? Like if it's 1 year long, you would take care of hundreds of people during that time?
Of course.
Yeah.
Mm-hmm.
So that's really where you're getting that super specific experience before you head out on your own or do something different.
Right, and you see really all types and all severities, which sometimes you don't see in certain times of your life.
So what kinds of patients were those? They were people with breast cancer?
They were with, yes.
Yeah.
Mm-hmm.
What was the, I'm trying to place about what year this was, because breast reconstruction has evolved over the years. So what kinds of breast reconstruction techniques were you learning there?
So, traditionally, breast reconstruction, let's say 20 years ago, was really limited to implants and then certain autologous or muscle rearrangements, to cover the implant or to create a breast. It wasn't until probably the early 2000s where actually performing free flaps and muscle sparing free flaps to create a breast, such as the deep to deep inferior epigastric perforator flap, and then the PAP flap, and then all these other ICAP flaps, and these are all different types of perforator flaps, which I was educated and trained in, which really opened up a whole new avenue for women to have natural breast reconstruction, which wasn't available prior. The thing with these types of surgeries is they were really very much an expertise niche, and that very few people at the time were trained to do that. So I was lucky to be with one of the pioneers who took me under his wing, and that's how I became proficient in doing these surgeries, and as a result became known for doing these surgeries.
And are you still doing them today?
No, I'm not. I'm not. Not as much, not doing.
Would you mind taking a sip of our coffee? Just
I'm getting dry.
Perfect.
I do a lot to, I still continue to do second stage and third stage reconstructions. But microsurgery is such a wonderful part of one's practice. But I think that as I've evolved, my experience, my technique, my interests have evolved with me. And I remember my mentor saying, you know, you're going to gravitate towards cosmetic and aesthetics. And I was always like, I didn't really enjoy that phrase because I felt that when I was doing a reconstruction, that was equally an important part. So it was always there. It wasn't one or the other. But I think in life, you know, everyone has a path, and I've had quite a unique one. And when my mother died, I had kind of a life-changing event and decided that I needed to do something different. So I went to the Middle East and had a cosmetic practice in Dubai. And that kind of changed my whole kind of emphasis on my practice. And that was the start of me kind of gravitating to more aesthetic surgery.
How did this opportunity come to you to go to Dubai?
So I always have people contacting me about different positions, and you know, I went to school in England and I did a fellowship in Paris. So I've always kind of been around in the European scenes on some level. And people just email me and say, hey, I have this opportunity. Is this something you're interested in? I'd be like, no. And this particular opportunity was coming across my desk, my email quite often. I kept saying, no. And then my mother died. And all of a sudden I was sitting there and I looked at my email, and just randomly that from that same individual popped up again. I'm like, you know what? Why not? You know, why not? I've done, you know, it's funny. It's like I hit the midlife crisis. I bought a sports car. You know, let's do something outside the box. So met with them, discussed it, and sure enough, I started commuting to Dubai and did that for 4 years. I commuted almost every 6 weeks.
Well, what kinds of patients were you seeing in Dubai then?
Oh, gosh. And I have to say it was one of the best experiences of my life. Everywhere. I mean, patients from Russia, from all over the Middle East, Europe. I mean, everyone, all different types. I mean, cosmetic surgery or aesthetic surgery done in other countries can be very different than here in the U.S. So you see things that would never be allowed here that would be allowed in other countries, and then they come to you and they're like, okay, now fix me. And you're kind of like, huh, never even seen this.
Oh, so people were coming because they were hurt by surgery.
Sometimes.
Or
they just wanted me to do whatever. You know, it was a mixed bag. Yeah.
How long were you over there then?
Intermittently for 4 years.
And so did you just stop because it got to be too tiring to keep going back and forth, or?
Yeah.
Yeah.
I also had a dog.
Your dog. Okay, tell me about your dog.
Yeah, so my dog Wallace, who's my baby. You know, I always joke around that I work for him to have the lifestyle he has. And when I get really kind of stressed, I always tell him in the morning, I'm like, what are you going to do today? Why don't you get a job? Why don't you pay for this lifestyle? He's a West Highland Terrier, and he's a perfect city dog. He's a go-getter. He's loyal. He's fierce. He's fun. He's playful. He's coiffed. Of course, he's a plastic surgeon's dog.
Of course.
He walked in the Scottish parade about 4 years ago and ended up in the post.
Oh.
You know, because Grand Marshal actually picked him up, and he was in a Scottish kilt and his little tammy. And it was in his colors.
That's fantastic.
Yeah. So Wallace gets a lot of attention.
Oh, Wallace. So, where's Wallace today?
Wallace is sleeping.
He's at home.
In my bed.
Mm.
Yes. He is not a morning dog. You laugh. He really isn't. I wake up at 5:30, you know, to go to work, and he looks at me and he's like, shut the light off. You know, like, what are you doing? Go. You're disturbing me. And then I have cameras set all over, you know, my apartment, and I can see him as soon as I leave. He's down and out. until about 10, and then he slowly wakes up around 10 a.m.
Wow. Yeah, he does need a job.
I know.
Are you sure he's not depressed?
Yeah, I thought about that, but no, he's really happy, smiling, up all night partying. I think he has a whole bunch of friends outside with his nanny. They have
He has a
play dates.
nanny?
He has a nanny, yeah.
Oh, Wallace.
And I walk on the street on the weekends when I'm not working, obviously, and people come up and they're like, "Hi, Wallace," and I'm just kind of looking at them, and they're like, "Oh, are you the new nanny?" And I'm like, "No, that I'm the owner. I'm the mother." And they're like, "Oh."
So Wallace is well known in the neighborhood.
Very much so.
Okay. So you work long hours.
Mhm.
You're taking care of a lot of people. What kind of patients are you seeing these days?
I mostly see patients that have had cosmetic surgeries that have not necessarily been ideal for them.
So a lot of revision.
I'm sort of slowly moving into that part of my life where I'm getting the revisions. And I remember one of my mentors says, you know, you get to the point in your life where you finally kind of hit your stride, and that's when you know, when you start getting the hard cases, the cases that people have done and don't want to do anymore, and they kind of come to your door.
Yeah. This happens to us, doesn't it?
Yeah, I don't know if it's good because it's like, hey, but then you're like, oh, I'm getting older. Okay.
Yeah, I just feel like I just kind of hit that. Like, all of a sudden the hard problems are the ones coming my way because I'm the only one that can solve them? Why?
I know, right? Like, shouldn't there be other people? And why can't I have the easy stuff? I want my life to be easy at this point. I've, like, worked very hard. We all have, right? We want a little bit of a break now and then. But it is an honor, when I do have, these patients, and I like the challenges. I really do enjoy them, and I'm always trying to improve my surgical technique, my care, and you can't do that if you just do the simple things over and over again. You need that little bit of that challenge to get you moving to that next stage.
Is there a certain type of patient that you want to see these days? What does that look like?
No, I'm equal opportunity to everyone. I think it's more or less, the better question is that patient does want to see me?
I think maybe where I'm trying to go with that is, what do patients find you for? What are you known for?
Right.
When people say, I need help with fill in the blank, oh, you need to go see Dr. LoTempio, what is that thing that they're talking about you?
Right. So I think, nowadays I'm known for breast surgery and liposuction and fat grafting. Those are probably the three big areas.
Fat is a very popular topic these days.
It is. Absolutely.
So how are you thinking about fat in terms of moving it around, keeping it, getting rid of it, shifting it to other places on the body? What's happening there?
Yeah, I'm equal opportunity with fat. I like to do everything with it. I do everything with it. I move it around, I take it out, I put it in. I switch places with it. I sculpt it. I do a bunch of things with it. I repair things with it. It really is a not a particle, but
Versatile?
a graft, a versatile graft to be able to use in so many different areas of the body and so many different reasons to use it in all different types of patients.
A lot of women are coming in and asking, at least from what I hear, people are asking for ways to have breast augmentation without implants. Are you starting to see that happening?
Yes, but I've been doing that for about 15 years. So for me, it's nothing new. But yes, there's definitely a subset that wants the natural breast. And I definitely see those.
What do you think the reasons are behind that?
Multifactorial. I think women have an idea that implants are unsafe and they're scared, and everyone knows of the horror story, and they don't want a foreign body in them. And they don't want to be really big, and they don't want to look like they've been augmented, and they just want a little, little fullness, a little pop, cute little black dress. They don't really need to wear a bra when they go out, a little bit of cleavage, but nothing like over the top, such as their own zip code with their, breasts. Not like the 80s where, the triple G's were being put in, and the large breasts. I think women now want more of a natural and more of a reasonable shape to their body, natural to their body shape.
So how do you accomplish that with things other than implants?
Well, it's, again, they have to have a certain breast size to start off with. They have to have a certain skin quality. But really, more importantly, they have to have a certain type of medical history, because fat grafting can distort cancer surveillance. So we have to make sure that they're educated, that the older women that have a very high family history or more of an in-depth family history, that they need to be aware of certain things that they may occur once they have fat to the breast, and education's really key.
Is there something that you do when you see a new patient then to assess their level of cancer risk? Is that something that you're paying attention to?
100%.
What does that look like?
Well, it's a series of questions. I mean, I think my staff always laughs at me because they're like, send Dr. LoTempio and she could find out anything. She could find out, what their taxes were like 20 years ago. I'm really privileged in the sense that UCLA really was an incredible teaching institution that really, again, I was a cancer surgeon. My background is cancer. So I was taught by the best of the best to really take a detailed history within a very short period of time. And I can extrapolate and actually get the information I need very quickly, and then determine what I need to do and not do.
Have you actually caught cancer in anybody before in a consultation or before they've had surgery?
100%.
Yeah.
Mm-hmm.
Probably more times than you want it to happen.
And diseases, autoimmune diseases.
Oh, interesting.
I've sent patients to rheumatologists, hematologists, and I've gotten patients' letters saying, like, if it weren't for you, I might not be here today because you sent me to X, Y, and Z, and they picked up X, Y, and Z, and now they're treating me.
So on the list of your magical skills, you can identify whether someone is a Bills fan, but also detect whether they may or may not be at risk for cancer or autoimmune disease. What are your other secret skills?
I think most doctors do. I mean, we're all educated. I mean, there's all a series of questions that all of us, know what to ask. Not everyone has the time. Not everyone has that rapport with patients to be able to do that. I also was a nurse. Did you know that?
I did not know
I was a neonatal ICU nurse.
How did you?
NICU nurse.
When did you have time to be a nurse before you became a doctor?
Before going to med school, I was a nurse. So my father. So yeah, this is an interesting story. I digress. Let's digress for a moment. My father said, I'll pay for your education, but you need to become a nurse. And I'm like, what are you talking about? So my father had a home healthcare agency, and his goal was for me to get an MBA and take over the company. So he thought, okay, she doesn't really want to become a doctor. She doesn't want to become a surgeon. I'm like, Dad.
He didn't believe you?
Didn't believe me. Since 6 years old. He's like, you're a woman. You don't want to do that. And that old-fashioned. So I said, okay, fine. He goes, you could be a double major, triple major, you could do anything you want, but you're going to become a nurse, you're going to be licensed and boarded, and you're going to work 1 year. And after that 1 year, you can do anything you want. So I said, fine. So I was double major, went to school in the summers, went to school all year, got my nursing degree, got other degrees, got my pre-med in, graduated, got a coveted position in Washington, D.C. in the NICU, neonatal ICU, worked for 12 months. On the day of my 12-month anniversary, gave him my resignation, applied for J.Crew, became head cashier while I was applying to medical school.
What?
And I went to medical school.
They say everyone should work either retail or restaurant at some point in their life. So this is the part where you fit that in.
Yeah. Yeah. I was tired of wearing scrubs all the time. I wanted clothes.
What did the experience of being a nurse teach you about being a doctor?
Everything. Yeah. Not only do you have such a great appreciation for our staff, and I think sometimes as doctors, we kind of forget the people that support us. And we're only as good as our team. You know, it's not an individual, it's a team. And as a nurse, you understand all avenues of the hospital, the support structures, how important they are, not only for the patient's family, but it's the ability to get along, it's the ability to do what you need to do as a medical professional. And again, really the key is listening, understanding, providing the care, providing support, which I sometimes think as doctors it's hard for us. We don't always have the time and we don't always have necessarily the skill set to do that. So I think I became unique in a sense that I had that.
I've heard it said that they train that out of doctors, but it sounds like they trained it into you first, and they couldn't get rid of it.
Yeah, no, probably not with me.
You mentioned earlier you're gonna go home to Buffalo today for an art festival. What other kinds of things do you like to do outside of work? And Wallace, of course.
Yes, right. So I love to play tennis. I try to play tennis, I should say. I enjoy that. I like to paint. And don't laugh, it's paint by numbers, but I still like to do it. It's a way for me to relax. So one of the things is, as I've noticed as I've gotten older, I always have to do things with my hands. And I think it's a surgery thing. I always used to kid around and be a great smoker, except I'm completely 100% against it. But, you know, because I'd be great with my hands, like they're constantly doing something. So I do a lot of needlepoint, I do a lot of painting, things like that, tennis. I try to be social. I belong to clubs. You know, I try to be as well-rounded as I can.
One thing that is standing out to me here is that you like to work and you keep yourself very busy.
Yes.
Yeah. What's coming for you in the next year?
Greatness.
More greatness.
Yeah, no, I think that this year is a great year for me. I think it's going to be, it's a moment of revelation for me this year. Not to digress, but I did lose my dearest friend to cancer, complication from cancer. My roommate from college, my sister, my aunt. And I kid around saying that I'm very fortunate in life, and I think a lot of it has to do with the people I surround myself with. My parents upstairs, she's upstairs now, and I think I have some guardian angels that are kind of circulating, and I think that with sorrow comes greatness and happiness, and I think I'm on that path to achieve even more.
It sounds like it. You'll have to come back and tell us in a year.
I can't wait.
If someone's listening today and they want to reach out or find out more about you, where should they go online?
Oh, great, yeah. So it's LoTempio, plasticsurgery.com, or Dr. LoTempio NYC, TikTok, Instagram, Facebook, you know, LinkedIn. I think you can follow me everywhere nowadays with technology.
You're not hard to find.
No. Yeah, but I think you could really find us through our website, and Jassera is my practice manager, and she's just amazing. Again, you know, when you surround yourself with really amazing people, I think it only makes you better, and I'm so lucky. So, yeah, you know, I'm here. I'm in New York. I'm on Fifth Avenue, my brand new office. I'm right across from FACS. So go buy a purse and come see me.
That sounds like a good plan.
Yeah.
Thank you. I'll put all those links in the show notes. Thank you
Great.
for sharing yourself with us today.
Absolutely.
It's been a privilege.
Hey, thank you. This has been absolutely wonderful. Thank you so much. Such an honor again.
You're welcome.